Are you ready to start your physiotherapy career by landing on your dream job? But this process really isn't that simple, and getting advice from everyone from left, right, and center can be quite overwhelming. So, to help you with all of this, I want to share my experience as a candidate and as an interviewer and help you understand the structure of these interviews so you are able to tackle the curveballs that are thrown at you and help you stand out. My name is Kuratulaine and I'm a physiotherapist. And on this channel, we help students achieve their career goals and patients achieve their health goals. First things first, an interview is not just a tick the right box exercise. There are a few equally important things that you have to nail before even getting to the questions part of the interview. And in this video, we are going to start with some general interview day preparation and then move on to the questions that you should be preparing. Make sure that you check the interview date, time, and address. Show it to a friend and let them read that out to you. And after that, mark this in your calendar, as well as write it on a sticky note and put it on a mirror or a desk that you will regularly visit. If the interview is in an unfamiliar place, I would recommend going there a few days beforehand so you see the location, you know how long it takes and what sort of transport you need to get there on time. If the meeting is virtual, then I would recommend setting up a mock interview on Teams, Zoom, or whatever software it is scheduled on. So you are familiar with the software, you know how to enter it, you know how to exit the meeting, and you also know how to screen share in that meeting if needed. If the meeting is virtual, I would recommend being in the virtual lobby 10 minutes beforehand. If it's in person, then I would recommend 20 minutes beforehand. I personally am so afraid of being late. Wherever I have to go, I'm usually there an hour or so beforehand. But luckily, I live in London, so it's just really nice exploring the neighborhood, going for a walk around the area, maybe grabbing a cup of coffee. Moving on, when it comes to interviews, first impressions matter a lot. So make sure that you're wearing nice, clean, ironed clothes, you're wearing cologne, your breath is fresh, your hands are moisturized, your nails are done, your hair are neat. Just that you're on top of your personal grooming, because this will leave a very good and lasting impression. Now, this is highly coincidental, but the Band 5 job I got was the one where the interviewer complimented my trousers. So putting in that time and effort shows that you're not taking this lightly and you really value this meeting. Interview stress can affect your appetite, so whether it's high or low, make sure to eat and drink beforehand so you're well hydrated and you have good energy. Once you've left your home on the interview day, just be on your best behavior. You don't know who you're gonna run in the parking lot or the tube station or the coffee shop. Just keep smiling and be pleasant. On your way to the interview, make sure to read the job responsibilities and the job description again so everything's fresh in your mind and you know what you're going in for. Now that we've reached the location, let's take a step into the meeting room. It is no doubt that interviews are an extremely nerve-wracking process, but try to bring calming thoughts into your mind that help you relax. And remember that the interview knows that you are under a lot of stress, and most of the time they want to provide you an environment that you're comfortable in so you can represent your true self, because this will also help them hire the best possible candidate for their company. So rest assured that the interviewers are on your side. And being on the other side of the process, I can guarantee you that we are always constantly trying to find positive points and make sure that we're not asking any questions that would be beyond the scope of the band in question. Now let's move on to the questions. Most Band 5 interview questions are divided into two categories: the behavioral or values-based questions and the clinical questions. When a question is asked, make sure to keep a pen and a paper on hand so you can write down the points of the questions. Gather your thoughts, take a few seconds, and then answer. And always include very good examples in your answers and be very thorough and detailed with them. And if there's any confusion, don't shy away from asking the interviewer to repeat the question again. Now let's dig into the behavioral questions. Just a little disclaimer before that no one can tell you exactly what questions there will be in the interview, but we can give you good examples to prepare so that when you're well prepared with those, you can easily adapt them to the questions that are asked. These behavioral or values-based questions again will be divided into two parts. One, your approach towards your patients and your development as a clinician, and two, your behavior towards your team. 9 out of 10 times, the first question is going to be about your introduction, why you're interested in the said company and said role. Always reply with personal stories of, let's say, why you were interested in MSK Physiotherapy, and then progress to how your current skills would be suited to the role that you're applying to. and how this role can help you excel further into your ambitions or whatever goals you want to achieve. Talk about the trust in comparison to its competitors, why this trust is on top of your list. This could be because of its values, its geographical location, because someone you know recommended it, or because your professors asked you to go there. Moving on in this category, let's start with your values as a clinician. In this part of the interview, they can ask you questions like, according to you, what are the components of good quality patient care and how do you implement this in your practice? Give an example of a time you demonstrated excellent communication to a patient to help them understand their condition. Can you describe a time that you were working with a difficult patient? What were the challenges and how did you overcome them? How do you manage a work-life balance? How do you manage stress? How do you stay up to date with research? If you suspect a patient is a victim of physical abuse, what would your plan of action be? Moving on, your relationship or your behavior in a team, you can be asked questions like, describe a time that you faced a challenge with a colleague and how did you overcome it? Or give an example of a time that you demonstrated good leadership qualities. Or if you came across a patient who was seen by your colleague before and they missed on some serious red flags, how would you proceed? These are some common questions that you can be asked in this part of the interview. If you answer these with good examples according to the STAR technique, you will ace this part of the interview. The interview marking guides usually have a key that interviewers have to follow, and the highest marks are often given to candidates who include a lot of personal examples, are thinking outside the box, and are very proactive in their approach towards everything. Hopefully, this helps you understand this part of the interview, but if you have any questions or any question in particular that you're struggling with, let us know in comments and we will try to answer that in the best way possible. Now, let's move on to the clinical side of the interview. At a Band 5 level, candidates are not expected to solve complex medical problems or patients with widespread pain. Rather, they are expected to know basic common pathologies, common clinical presentations, and how to screen for red flags. The most common clinical scenarios given for Band 5 interviews are back pain, knee pain, and shoulder. For each of these, you should know most common clinical presentations, red flags, basic assessment, differential diagnosis, and management based on NICE guidelines. For each clinical question, you will be either presented with a scenario or just a direct question. If a scenario is presented to you, it is sometimes very obvious what they're trying to ask, but don't jump to that conclusion. Gather a full subjective history, including what's given and what additional information you would require. Then explain how you would do an objective assessment, including everything from a functional assessment to special tests to neuro assessment. If you are taking names of special tests, tell them why you are doing those. For example, I will do a McMurray's test to check for the meniscus. And if you are saying that you will do a neuro assessment, be very thorough and detailed with what a neuro assessment is, what the components are, what you will do. So make sure you mention, I will check for dermatomes, I will use a cotton swab or a neurotip, I will differentiate between light touch, pinprick, myotomes, I will also do reflexes, knee reflex, ankle reflex, I will check for Babinski, Clonus, SLR. Just be sure to be very in-depth with all the explanation of what you're going to do with that patient. When I was giving my interview, the mistake I made was that when I started my answer, the interviewer was writing down my answer and I would stop and let them finish what they're writing because I felt like they might miss the valuable information that I'm giving them. But in retrospect, I think that was a really bad move to do because you lose your train of thought, you're left short on time. So you just need to keep going and just keep going, saying what you have to say until you are done and you have to stop. And if you have been asked a direct question, like for example, how would you treat someone with mechanical back pain? Again, start with the assumption that this was told to you by a patient that I have mechanical back pain, how can you help me with that? So even for this, you need to follow the same approach. You need that full subjective, you need that objective, you need to rule out the hip and any other surrounding joints that could be influencing that back pain. And for treatments, as I said before, use the NICE guidelines and use a holistic biopsychosocial approach. Now let's discuss a few example questions for each region, starting from what's probably the most important, red flags. You should know general health red flags as well as regional red flags, so like for cervical, thoracic, lumbar, knee. Questions around red flags can be like, can you describe what you understand by red flags in MSK conditions? What would you do if you suspect that a patient has a certain red flag? How do you communicate red flags to a patient, and how do you safety net them? Now moving on to the next section, which is back pain. In back pain, most commonly the questions will be around non-specific low back pain or radiculopathy. But whatever the back presentation is, make sure to rule out the hip. Questions can be like, how would you differentiate mechanical back pain to nerve root back pain? Or what are the components of a lumbar spine examination? Or what are the signs and symptoms that suggest a more serious underlying condition that can present as low back pain? What sort of exercise or treatment can you recommend with someone with lumbar radiculopathy? Or how do you screen for inflammatory signs with someone with back pain? Next up, we have our shoulder. Shoulder questions will be mostly around frozen shoulder, rotator cuff related pain syndrome, or maybe falling on an outstretched hand. And for shoulder, you always need to rule out the neck. Questions can be like, how would you differentiate between frozen shoulder and rotator cuff related pain syndrome? Or can you provide a rehabilitation program for someone with shoulder impingement? Or how would you approach treatment for someone with a frozen shoulder? Last but not the least are knee. The knee questions for a Band 5 interview will mostly be around knee osteoarthritis, but looking out for some ligament injuries and unhappy or unholy triad, that's also quite important. And again, always rule out any involvement of the surrounding joints like the hip or the ankle. Questions around the knee can be identify any serious signs and symptoms in a knee joint pain. How would you assess someone with knee osteoarthritis and what treatment options are available? And can you differentiate between ligament tears and meniscus injuries in a knee joint? Obviously, it is very good to prepare conditions of the whole body, and my approach would be to start one joint at a time and prepare conditions for each joint. But if you are able to prepare everything that we have discussed today, this should put you in a good position because these are the most commonly asked questions for a Band 5 interview. And if throughout the interview there's something that you're unsure about and you don't know the answer to, avoid saying, I don't know. Rather, think of what experience you have is closest to the condition or thing in question. For example, if someone is asking you something about total hip replacement and you have no experience with that, maybe you have some experience with total knee replacement, so you can kind of restructure your answer. So instead of saying that I don't have any experience with total hip replacement, so I don't know what to do, you can maybe say that I have some previous experience with total knee replacement and I would try to use some of that knowledge to this condition in question. I will make sure that the patient is safe. What they're doing right now is a safe practice to do. I will make sure that they're healing well, the joint is not red hot, swollen, and I would like to have some insight from a more experienced clinician and have their guidance in terms of how to proceed with this and look at this as a good learning opportunity. If you feel like that we have missed something, then do let us know in comments so everyone can benefit from it. Acing the Band 5 interview is just the start of your beautiful, successful physiotherapy career. So make sure to keep working hard and keep honing your skills, and good luck with your interviews, and hopefully we'll see you soon. Ciao!